For the past 5 years, the worldwide estimate of new adult HIV infections is 1.9 million annually, with the new HIV infections rising in some region. This year's campaign for World AIDS Day 2016 is Hands Up for HIV Prevention. Dr. Michael Harbour from Merck & Company is here to tell us the latest regarding the prevention and the fight against HIV/AIDS. Dr. Harbour, thank you for coming to the program. We appreciate it.
Happy to be here, Tom.
So tell us, what's new in the treatment for HIV?
So the treatments have really gotten much better, and that's the great news about HIV treatment in general. We have many single tablet regimens where somebody can get their entire HIV regimen just in one tablet once a day. And these are very potent medications with fewer side effects, so that's great news in terms of helping people to be compliant. But there's also some new formulations that are being developed as well for HIV.
And tell us about those.
Sure. So one of the formulations would be a long-term injection. So somebody can get injection in their arm muscle, their buttock, and then that would be the only thing that they would need to take for a couple of months until they would go back and get the next injection.
Wow, so a couple of months instead of an everyday regimen.
Exactly.
That's a huge improvement.
And another type of formulation that's under development is an implantable medication. So just as women can get long-acting contraception under the skin, an implantable device could be put in, small little pellet that would release medication over time. So somebody may not need to take medicines for a couple of years before the drug came out.
So instead of every day or even every couple of months, it's years.
That's what we're looking at.
Wow. So talk to me about HIV PrEP. It's becoming more mainstream, and I wanted to talk about any concerns you might have or any side effects that happen in that treatment.
So just for your viewers, PrEP means pre-exposure prophylaxis. And that basically is a person who's at risk of HIV, doesn't have HIV, but at risk of HIV through sexual acquisition. They can take one pill once a day, this is FDA approved, and prevent them from getting HIV.
But you got to be vigilant to take it every day, is that right?
You have to be very vigilant. You have to take that tablet every single day, and there's still some risk involved with that. It's like anything, nothing is 100% foolproof all the time. The efficacy is quite good, but if you have unprotected sex, that doesn't stop you from getting sexually transmitted diseases like gonorrhea, chlamydia, syphilis, herpes. So, and if you were to acquire one of those illnesses, it could even make getting HIV a little bit easier. So, there's some risk, but it's great news in terms of prevention. It's the best that we have at this time. And maybe some of those long-acting medications could be used as PrEP as well.
Wow. So what's happening with HIV cure and vaccine? It's been on and off. You hear things. Are we closer to it?
Yeah, so that's a great question. Let's start with the vaccine. So there have been thousands of different vaccines that have been looked at and tried over the past 20 years. We are still no closer to an excellent, viable vaccine at this time, but it really remains an important goal of the medical community to be able to find a vaccine. So large pharma companies, the NIH, are all working on this endeavor. With regard to cure, I think it's important for us to distinguish the types of cure that we need to think about. When we think about cure in general, we often think about trying to get rid of all virus in the body.
Right, just eradicate it, right?
Sterilize the body of all virus. And that would be a very difficult goal. It's been done in this very famous Berlin patient who ended up having to have a bone marrow transplant because he had an underlying leukemia. All of his bone marrow was wiped out through chemotherapy, radiation, and he was given a bone marrow transplant. He's the only patient that we've ever had fully cured, and that was a sterilization cure. It got rid of all virus in his body. But that's a risky endeavor to go.
That's a difficult road.
You almost can get killed in trying to save yourself.
Save yourself, right.
Yeah, exactly. So then the next type of cure that we think about is a functional cure, whereas we can get rid of enough of the virus in the body and then have the body's own immune system come forward and keep it in check. So there are strong medications that would work to try to diminish the amount of virus, push it out from the areas of the body where it is in a reservoir where it's hidden in lymph nodes and tissues, and then our strong antiviral medications would keep it in check or keep the virus in the blood undetectable. And then there are other antibodies that could be given as part of a cocktail. So some broadly neutralizing antibodies to also suppress this. And that is where we may come up with a functional cure. Not a pure sterilization, but enough to keep somebody fully controlled with the virus.
With the functional cure, so you're basically pulling upon your body's immune system and managing it, right?
Yes,
As
yes.
opposed to the sterile cure.
So these are goals, that's kind of what's on the horizon for the cure. I wish there was an easy answer, but we're going into, 3 onto 4 decades, and we're still with this disease, and it's still a very difficult disease. But the good news is that what we've learned with HIV has been very applicable to many other diseases as well, and especially infectious diseases. So we should feel proud about the work that we've done. It's really helped the entire medical community and other patients. And so don't let anyone try to put anyone down for being HIV positive, because we've all benefited from the work that's been done.
And then so how optimistic is the research community on maybe a scale of 1 to 10?
I think optimism is high. That's, optimism comes from hope. There's the realism as well, that it gets harder and harder to come up with new therapies, especially when we have really great therapies right now for the treatment of HIV. But hopefully we'll have some breakthroughs and move from there.
So you feel optimistic then?
I do.
Good. So Dr. Harbour, thank you for sharing the latest in the fight against HIV/AIDS. For more information regarding the testing and treatment of HIV/AIDS, please contact the PACE Clinic at the Santa Clara Valley Medical Center, 408-885-5935. Let me say that again, 408-885-5935. You're watching Outlook Video. We love to get mail from you. Email us at comments@outlookvideo.org.
To contact us by phone, call 408-293-3040, extension 205.
Visit our website at outlookvideo.org.
Subscribe to our YouTube channel at youtube.com/outlookvideo.
And connect with us at facebook.com/outlookvideo.